Okay, I believe that this is working, and I apologize that I am a novice in the use of Facebook. Um, my name is Regina LaRocque. I live here in Wellesley, and I am a board member of Sustainable Wellesley, and it is in that capacity that we have offered this opportunity to I've offered the opportunity to make myself available to answer some questions and make myself available as a resource. So I just want to tell you who I am so you understand. I am an infectious disease physician, and I work at Mass General Hospital, and I've been there for more than 15 years. I do research in infectious diseases with a particular focus on bacterial infectious diseases like cholera and bacteria that are resistant to antibiotics. And I live in Wellesley. I'm on the Natural Resources Commission, and so I have met many people in town through that. And I'm also a parent of 2 boys who are 13 years old, and my husband, who is also a doctor, an infectious disease doctor. So that's who I am. I'm not representing anybody other than myself tonight, and I just want to make that clear for starters. Secondly, I also want to make sure that everybody understands that there are a lot of excellent resources available to answer questions. And I refer everybody primarily to the coronavirus page of the CDC, which is excellent and is frequently updated. The Massachusetts Department of Public Health has a web page. The town of Wellesley has a web page. These are all excellent sources of information, and they are being updated frequently. And so I refer folks to those as reliable sources. So I have a list of questions in front of me, and I am afraid that I probably can't really get through all of them. And so I think what might be helpful is perhaps if I just give you my 20,000-foot summary of the situation from the perspective of myself. I think we are in unprecedented times, and that's just an important thing to state for the beginning. I have been working in this field my entire career and have never seen anything like this. These are the types of pandemics that we have read about, but have never personally experienced. So I think that's something I want to acknowledge up front. Another fact I want to acknowledge up front is that this is a fast-moving situation, and there's a lot we don't know. And I think it's important to understand that there are many big gaps in our knowledge about the virus that has emerged. And I think many of us are accustomed to living in an age when we have a lot of detailed scientific information about things. And this is a circumstance where that is not really the case. A lot of information is emerging. It's emerging quickly, but the virus is also moving rapidly and is outpacing some of our knowledge base. So I think that's an important thing to understand as well. I'll just give you the bigger picture of how I think about infectious diseases and pandemics and respiratory illnesses. So I think this is a scenario we're seeing here, which has been kind of long a concern for infectious disease and public health people, namely that a new virus would emerge and then be able to spread rapidly around the world. And the reason why we have always been concerned about that from our perspective is that we know now we live in a world where people are connected in ways that they really weren't even decades ago. So people can move from one part of the world to another very quickly. So things that happen in very remote areas can rapidly affect us in our communities thousands of miles away. And that's precisely what we've seen here. We do know that lots of viruses live in animals, and they can exist in animals and not cause disease in animals. But when they cross over from animals to humans, there can emerge a situation where a new virus is infecting humans and making them very sick very quickly. And then in the space of being able to spread around the world, you have what is called a pandemic. And that's what we see here. And there have been, in the last decades, emergence of similar viruses to this one that have arisen from animal reservoirs, is what we call the places where these viruses normally exist in the world, and have leapt into humans. And we have seen those events occur. Those events have been contained more successfully than occurred here. So the examples there are the previous SARS coronavirus and the MERS coronavirus outbreaks that occurred. And there have been other similar scenarios where viruses have emerged, like the Nipah virus in Bangladesh. And so this is a scenario that we are aware of can occur. So we are in a much talked about but never previously experienced scenario. And we've seen the steady march of the virus causing lots of illness and disruption, starting from Asia and steadily moving across Europe to the United States, and here in our own communities now. So this is kind of a somewhat predictable order of events based on what we knew was coming from other parts of the world. And I think it's really important for us to kind of inform our thinking about this by the experiences that we've seen playing out in other communities. And so what's happening here in Massachusetts, I guess, or here in the United States, I think that really the big transition that has occurred and that I would hope to explain is that, early on when a disease like this is spreading, the focus is on trying to contain it and quarantine it. And that was the early attempt. I kind of imagine that we are all like kindling, and we're all a big community of fresh, dry wood kindling. And initially you're trying to capture each spark that comes into your area of kindling and stamp it out. But we've kind of moved into a phase of, we have moved now to a phase of the epidemic where we can't really contain it. And it is now spreading within our own communities domestically. And so that's a different type of scenario than what we had been in before. So, I think that's an important component to understand. An important component to understand. And then I just want to underscore another kind of basic biological point, which is that this is a new virus, which means that nobody in the whole world has ever been exposed to it before, which means that nobody in the whole world has any immunity to it. So we are all susceptible to this virus. And we know that eventually, with the way it has spread, we will all get it. It's really more a matter of when we get it than if we get it. And we know that some people, when they get viruses like this, are more prone to getting very sick. And some people have asymptomatic infection. That is just the way it is. So in the setting of a disease which is spreading in the community rapidly, there can be potentially lots of people getting sick very quickly, like a wildfire. And so the phase that we're in now in Massachusetts, I would say, is that the epidemic is spreading in our own communities. And it's not that there's sparks coming in, it's that the kindling has started. And how do we know that's the case? Well, unfortunately, we have failed as a country to establish an appropriate, I guess I don't want to say we failed as a country. I want to say that this is a formidable virus, and it is a uniquely difficult situation for any country to deal with. But I think we have not been able to establish a system that would have alerted us quickly enough to the arrival of the virus, such that we could have mobilized a containment response. We've not been able to execute that. So it's really important now that we are focusing as communities on limiting the immediate problems that are going to arise from having a highly contagious virus spreading in a community that is very susceptible to it. Because the concerns that arise in that setting is how much your healthcare system can handle that. I think we have seen the circumstance in Italy where a healthcare system that we consider to be rather advanced has been relatively quickly overwhelmed by the number of cases. And so that's really a key component of the concern here, is that our healthcare system is at risk of being overwhelmed. And I would say we are seeing that in the early phases locally and potentially in other places as well. And so that is why a lot of the messaging is around thoughtful accessing of medical care, and making sure that only people who are seriously ill are seeking care. So I think that is my thumbnail. It's not really a thumbnail. So I think I wish this were a little more interactive. I feel like I'm talking to myself. I'm going to turn to, I guess I want to just go back to what I was saying, because I think that there have been a few catchphrases that have emerged that I think are really good to be thinking about. And I really like the flatten the curve catchphrase, because I think that explains the situation very well, and the epidemiology that we're dealing with. The notion that a normal epidemic curve is exponential. Everybody's getting infected until things slow down. Everybody's getting infected until things slow down. So you don't want that curve to be going up, 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 up like this, where everybody's getting sick right away. Instead, you want it to slow down as much as you can so that less people are getting sick all at the same time. The other thing I think I neglected to mention is that, I think we're all fortunate to live in an era when we have access to very sophisticated and complex medical care. Amazing things that we can do nowadays: transplant organs and put people's take people's cells out and alter their genes and put them back into their body. These are amazing technologies. But it's important to understand that we don't have any technology to apply to this problem. We don't have a vaccine. We don't have a treatment. We don't have the traditional tools that we have been fortunate to have access to in our advanced medical care. And so part of the reason for kind of flattening the curve, as I mentioned, is that we really want to buy time so that we can work on all of those things and hopefully have people getting sick later on when we potentially have access to treatments and preventive vaccines. But it's important to understand that all of that is very far away, and there's much work going on, but none of that is coming in the next few weeks. So I'm going to, now I'm seeing some things pop up. Can you address responsible actions? Let's see. Okay, so I can't see that. Let's see. Okay, should I just? So I'm just going to share with you, my own perspective and what I've been saying and doing with my family, and maybe that will help you understand why this approach of social distancing is important. The reason why it's important to separate people is because that essentially is the only public health, that's the only intervention we have here to try to slow this all down. Hand washing, staying away from people who might be coughing, staying home when you're sick, preventing the spread is really so key in this moment. So I just want to underscore that there's still a lot we need to learn about how this virus behaves, how it persists on surfaces, but I'm just going to kind of give you a thumbnail of how we think about respiratory viruses. So I think we mostly think of this as being similar to a respiratory virus like the flu. And we know that respiratory viruses spread by droplets primarily. So when you cough or sneeze, droplets come out of your mouth. They go a certain distance, about 6 feet at most from where you are, and then they fall. And so that's the primary means by which this is transmitted. And, when it falls onto surfaces, those surfaces can have virus on them. And we are just beginning to learn we don't know how long it lives on surfaces. There's actually just today a paper out in the New England Journal where some experimental data is being done on that. But we know that it probably can exist on surfaces for a reasonable amount of time as well, unless they are cleaned. But the main mechanism by which it's spread is droplets coughing between people. And that's why this idea of getting people separated, decreasing the rate at which the virus can spread between people is so important. So I'm going to look at some of these questions that are out here and see if I can answer some of them. So, do the cases you're seeing in Boston represent a cross-section of people from the greater Boston area? So let me just talk about what we're seeing in Boston. So first of all, I'm just speaking as myself. I am one snapshot, and I'm not representing my hospital officially. But it is important to know that, yes, we are seeing cases of people who are ill with coronavirus coming into the hospital. And if you are admitted to the hospital with coronavirus, you are sick. So we have now people who are sick with the illness. I want to just share that there's a lot we don't know about how many people in the community are infected. So why is that the case? Well, that is the case because we have not had in place the ability to broadly survey the population for this virus. And we still don't have that in place. So even though we have numbers coming out of the number of cases of confirmed coronavirus, I would say those numbers are largely meaningless at this point. What is more important is what we see going on in terms of people coming into the hospital who are really sick. Because we have people who are coming into the hospital who are really sick, that means they are the tip of the iceberg, and there is therefore community transmission of the virus. It's moving around within our communities. So in that setting, it's really important to protect people who are most likely to get severely ill as much as we can, and to try to limit the spread of the virus as a society by doing the measures that have been undertaken to distance everybody from each other. So for myself, I will say that when I became aware that this virus had emerged, which was back in December of 2019, and all of us in the infectious disease community and other public health communities, when we knew the virus had emerged, were scared because we knew about the type of virus this was and what it could do. So, back then even, But more recently, in the last few weeks, I called my parents who are in their late 70s, and I said, you need to try to stay away from people as much as you can, starting now. And we talked a lot about hand washing, but I really strongly advised them starting a few weeks ago to essentially try to limit their interactions with others. And then, frankly, when I knew that it was circulating or was detected in their state, I told them to stay home. So I think that's the message that you have heard from, I think very clearly from other people in the CDC and the DPH, that the most important thing for people who are older or who have compromising medical conditions is to try to really they have to minimize their contacts with other people. And so what does that look like? That means you're in your home, or if you leave your home, you're 6 feet away from other people. And I think in the setting of the transmission we have in the community, that you have to remember anybody you're interacting with, you are interacting with everybody else they've interacted with. So it's important to remember that. So people who are medically fragile are really the ones that should be extra cautious about staying away from people. So what about the rest of us who are also isolating as recommended? I'm looking at my questions here. There's a lot of questions on this list. Do the cases you're seeing represent a cross-section of people from the greater Boston area? I mean, I guess I would say yes. I don't think there's any data on which area is more affected than another. We don't have kind of geographical data. What should I do if I want to see a doctor for a non-COVID issue, maybe a sore throat or a cut finger or a sore muscle or any issue that I might go to CVS walk-in? So I think this is really an important kind of acute issue right now, because it's worth pointing out that a lot of our routine healthcare provision is being pulled back from right now, because we really don't want people who are healthy and well, or people who might be asymptomatic but still infected, coming into healthcare settings. You don't want people who are well coming in, because you could get exposed to the virus there. And you don't want people who are ill coming in, because you don't want them introducing it. So I think, for instance, in our own practices at Mass General, we have cleared the decks for the next couple of weeks. So we are, in my infectious disease practice, we're not seeing routine follow-ups. We really are focusing only on seeing people in person if there's no other way to get around it. So there's been a rapid move away from routine appointments, et cetera. And I think that, for somebody who wants to see a doctor, it's probably, I would say, a good piece of advice to call ahead before you go in. And that way a decision can be made about whether you need to come in or not. And I do think that we are going to be looking at having to transition some types of our medical care to remote access, because the healthcare system itself becomes a place where transmission occurs, and there will be a need to minimize interactions in the healthcare setting. I think a lot of people ask about wearing masks, and at this point, the message has been made very clear, and I want to underscore that I agree with it, that wearing a mask by the general public is not recommended. One of the most important reasons for that is that we don't want to have a run on the supplies. I think that to some degree, people may already have gone out and done some of this, but I'm not walking around wearing a mask in the community, and I don't recommend that an average, otherwise healthy person do that. It is important to wash your hands regularly with soap and water for about 20 seconds, and that's equivalent to singing happy birthday. Are there food supplements that can boost immunity? I think I don't have any recommendations on that front. Is it safe to order takeout from area restaurants? I guess I'll say that I don't know the answer to that. And I, at this point, am cooking at home. And I think that when you cook at home, you have good control over the hygiene practices that are happening within your kitchen. And in general, I think that it's safer to cook at home. Any safe food handling tips? I think cooking everything in general, it is always best to eat food that is thoroughly cooked and served hot. Is it safe to go to the gym or fitness center? Well, I think some of that may have already been taken care of, but I would say that a gym or any place you're going where there's high touch surfaces that people are using and touching a lot, touching your nose or face and then touching the surface. This is why you don't want to be touching places where a lot of people are touching. From 2 seniors sheltering in place, what are the best protocols to follow with bringing, stowing inside our house any delivered mail boxes or groceries? How long is the virus viable on cardboard boxes? So, I think that anybody who's kind of staying in their house and having food delivered to them, I can't say that I'm worried about that. I think that you should take things into your house and then wash your hands thoroughly. And wash your hands thoroughly before you eat. I don't think that we can be worried that cardboard boxes or other things that food is sitting in is going to be a problem. So here's some questions about the healthcare system. Do you expect that area hospitals will be setting up additional temporary triage and patient care sites? And if so, do you have a sense of a timeline? I think this is an important issue that we need to point people's attention to, because there's a lot coming in the weeks to come in terms of how we are going to be able to handle this epidemic, and it is going to put a tremendous strain on our healthcare system. And I can't predict right now what it's going to look like in a week. And we are in an entirely different place today than we were a week ago. And I would say that we will be in an entirely different place in another week. And I do fully anticipate that we will have a hard time keeping up with the needs. If you look at other countries and what's transpired there, it's important to understand that this is a tremendous strain on the healthcare system. So I can't predict what will happen, but I do have concerns that there may be need for additional capacity or a different framework for how we deliver healthcare. That is a concern. How are healthcare workers faring so far? Well, I think it's a very stressful time for all of us. I think, and I include my nurse colleagues and everyone in the health profession, because as I mentioned, these are times that we haven't seen in our professional careers. I think we all do understand that healthcare workers have gotten sick with this, and that's a frightening thing. And I do think that there will be some need to address how to keep the healthcare workforce healthy through all of this, because you can't go to work if you are sick with a respiratory illness, and if you are confirmed to have coronavirus, you cannot work for 14 days at a minimum. So that becomes very disruptive to lose your workforce, number one. So how are healthcare workers faring? I'll just say it's a very stressful time for everybody. How do we keep our town's small businesses from collapsing and protect hourly employees? Well, I think that's getting outside my scope of expertise. I will say that, this is an incredible stress on society, and I don't know if we know the answer for how our society is going to come through this. What will be the ways that we address the challenges that have arisen? But I do think an important component is supporting each other, supporting our business community, reaching out to the people that we are affiliated with and making sure they have the financial support they need too. I think we need to understand as a community that some of us are more vulnerable to what's happening than others. Being isolated from other people is very hard for mental health. People who exist in or live in settings that are congregate and dense are at higher risk of this. And so there's many communities that we need to be thinking about carefully. Should kids be hanging out at Starbucks and having play dates, etc.? Well, I'll just say that from my perspective, I think they should not. I mean, I think we have our community in Massachusetts has quickly undertaken some very serious measures to allow for social distancing, and that is important. It is the most important thing we have. And we are in the early phases of an epidemic when the cases are going up quickly. And so frankly, the more we do now, the better. It's going to save us trouble later on. And I think that what that means is we want people 6 feet apart. When you're outside, you want to be 6 feet apart. And I think that's not something that many young kids are capable of executing. And so in many senses, it might be easier not to put them in that circumstance. I think we're all having interactions with our own families, and that's, understandable and appropriate. But when we're interacting with people outside our family, it's really better to keep your distance for now. It's not a social living scenario that we can exist in forever. And I think that we're going to have to figure out over time when some of those measures we can step back from, but we're not there yet. We are in the early phases of a response. And so now is really the time to maximize those measures. How much more dangerous than the cold or flu is this? I think that's a good question, and a lot of people ask that. I will say that it is more dangerous than the it's a little hard to compare. You're comparing apples to oranges to some degree, because I think we are accustomed to seasonal flu in our world. And actually, I think we are overly dismissive of how important seasonal flu is. Every year, 90,000 people in the U.S. die from the flu, so that's not trivial, and many people are hospitalized and sick from the flu. So the flu is bad. But we also, the reason why this is distinct from the flu is that we all have some immunity to the flu, not just as individuals, but as a community. And that's what protects a lot of us, because it's called herd immunity. the larger community has some protection. It slows down how quickly the virus can spread. And for even those of us who might get it, well, we have some existing immunity to it. So our body is less susceptible to severe infection. So the dynamics of what seasonal flu looks like in our lived experience now is really not an exact comparison to what we're looking at with this new coronavirus. We're all like newborn babies to that virus. And so we are all susceptible to it. And so the dynamics of how it spreads and interacts with the population are very different than seasonal flu, number one. But number two, people do die with this. And we're seeing kind of what the spectrum of that looks like in other countries' experience. And it's going to be hard to know what it looks like here in our community also. We certainly know that people who are over 65 are at highest risk, but that doesn't mean there's no risk to people who are under 65. And I think the other point I just want to make is that we don't have denominators on a lot of these numbers. It's a little hard to say with absolute precision that 3% of people in this age range die. That assumes a degree of knowledge about the numbers that we don't exactly have. So I think that's just worth cautioning people about. Okay, I'm not sure where I should go with this next. I don't even know who's out there. Let's see. Can you address responsible actions? I think I did that. Should kids be hanging out at Starbucks? Does wearing masks help or not? What are the best protocols to follow with bringing stowing inside your house? Yep. When will the medical community have protective gear? I think we've been working for, at least in my institution, we have an excellent group of people leading the charge to make sure that we're as prepared as possible. I can't speak to what other institutions have been doing to plan. I want to say that I conceptualize the hospital setting as kind of one small piece inside of a much larger problem that's going on. This is not... the hospitals can do their part, but this is spreading this is going to be spreading widely in the community, and it's not up to the hospitals alone to address this epidemic. We cannot. It is up to all of our communities to do everything we can to deal with this. And we in the healthcare system are going to be trying to take care of the fallout, but we don't hold the key to slowing it down or to preventing people from getting sick. That key is held by our communities, our civil society, our government. So our institutions have been doing their best to prepare, but at this point, we actually are already getting low on supplies, and we're just a few days into this here. So that concerns me. How do we appeal to teens and young adults to stick to social distancing? I think this is a really tough thing. How do you talk to kids about what's going on? These are frightening things to think about. And how do you talk to teens? Well, I think that, frankly, one of the key benefits, I believe, of the measures that have been taken to close the schools and bars and restaurants is because I think people have a hard time with these kinds of behaviors that we are asking them to engage in here. I mean, just to underscore that it's really hard to get people to wash their hands. I'm always flabbergasted, even before all of this, that the numbers of healthcare workers who didn't wash their hands before they went to see a patient, it's appalling. And these are highly educated people. So, simple behaviors, washing your hands, not picking your nose, not touching your face, mean, we are human beings and we have habits, and these habits are hard to break. And so I think that the measures that have been taken to close venues really underscores to people that this is different. This is important. These public health measures matter. And so I don't think we can ask kids to do it. You have to set up the structure where they don't really have a choice but to do otherwise. It's a little bit like, pilots and safety for pilots. You don't want to be depending all the time on the pilot to remember to do what he needs to do so the plane doesn't crash. You want to have systems in place to encourage and make things safe and encourage the behaviors that you need to have. So, I mean, I'm a healthcare worker, so I am taking exceeding precautions. Actually, I'm not interacting with anybody except my immediate family members, and I'm not interacting personally with parents, grandparents, and my children are not either. And I think that the safest thing is to be sticking within your own family unit and minimizing interactions outside that unit. And if you're at work, you just don't want to be interacting with a lot of people. It's really, I'm just going to draw a picture. I think we're used to in our interactions, especially living in the city, if these circles are people, we're all close together like that. But what we want to have is everybody, spread out like this. It makes it harder for the virus to be transmitted between people like that. Commenting as a town communication man. Oh, I think Stephanie Hawkinson was saying something about that. Yeah. Should kids be having play dates? I believe that one I answered. Do we understand whether this virus will mutate in a way? Well, that's a really good question, and I just want to underscore that there's a lot we don't know about this virus. But yes, viruses mutate, and it is highly possible, even likely, that the virus can mutate and have different features later. And one of the reasons viruses mutate is to escape immunity that people develop to it. So we can't predict what's going to happen along those lines. I guess I also want to underscore for everybody just a kind of a biology piece, which is potentially related to our own situation here with the Biogen conference. We know from the other coronavirus outbreak, SARS before, that there was a super spreader phenomenon where some people or some settings or some viral variants were associated with the capacity to spread wildly. And that phenomenon was called the super spreader phenomenon. And, it appears that this virus has some of those same features. I don't think we know, I can't tell you why yet, but I think that based on the number of secondary cases that occurred in some of these conference settings, there were events happening that suggest that phenomenon is a component of this virus and its epidemiology and spread. And so, again, the way to not have spreading going on is to separate communities, separate people. If I stay isolated and asymptomatic for 14 days, can I assume it's safe for me to visit an extended family member or not? I think it's an interesting question, and it's probably, I've been thinking this through as well about whether, going to see my mother-in-law, when would be a time to do that. As best we know, I mean, that for 14 days is going to be well outside the incubation period. And if you're well, then it's a reasonable assumption that you are I think the X factor in all of that is that it's likely that there's transmission by people who are asymptomatic, and so especially if you have younger people in your household, a 14-day period where you've been well, but you have kids around you, I worry that doesn't necessarily mean you're out of the window in terms of going to spend time with somebody who's older. It would be nice if we had some more hard and fast information around that kind of thing before people felt comfortable being in the presence of older individuals. And this is kind of getting back to what I'm saying of there's a lot we still don't know about the biology of this virus, that we need to just be cautious about what we know and what we don't know. So I don't know what I lost my train of thought there. I'm concerned about the lack of equipment. Oh, Caroline Egan, thank you for saying that. I feel a little awkward just sitting here kind of talking to myself, but it's 7:45, and so maybe I'll just sum up, and I'll say that I think these are unusual times for all of us. They're frightening times. I'm frightened. I think because we haven't experienced anything like this before. There are things that we don't know, and I think uncertainty is also a frightening thing. And so I just want to kind of share that I don't know all the answers to this either, and I don't pretend that I do. I do think that it is wonderful that people have implemented these very difficult to do behaviors in order to try to slow down the spread of the epidemic. And the reason we're really doing that is to protect our vulnerable people. And we need to remember who those vulnerable people are: older individuals, people with medical problems, people who live in congregate settings, people who are in prison, people who are immigrants. These are the people I worry about the most. Healthcare workers. I worry about the toll that these efforts will take on our civil society, on our businesses, on our mental health. And I think there's a lot ahead. There's going to be some hard things happening in the coming weeks, and I think our healthcare system is going to be stressed tremendously. So we need to be prepared for that, and acknowledge that. I do feel like we need to be honest that our public health infrastructure, any public health infrastructure, would have been in for the fight of its life with this, because this is a massive challenge. But this challenge obviously brings into high relief what the limitations of our public health infrastructure are, and we have seen them. There are many ways that we are not prepared for this, and there are many ways that we are not prepared for this, and that's been true, I think, in every society that it has hit. But namely, we're scrambling to, I think, get in place some of the capacity that we need in terms of identifying people who are sick and people who are not sick, dealing with individuals presenting to the hospital. But it is a challenge, and there's a lot ahead because we don't know the way this is going to play out in the coming weeks, and We don't know, frankly, in the long term, what the dynamics of this disease will look like in 6 months. So there's some unpredictable components here, which we just need to acknowledge. This is not a state that we can all be in forever, but it's a very important state for us to be in right now. I'd be happy to try to do this again. I don't know how helpful or interesting it is to anybody. But I do think it is now time for me to have my evening glass of wine, which is very important at the end of the day. We're working really hard in our academic institutions, and it's important to see communities coming together to try to do what needs to be done in a kind of warlike fashion, and it's hard, and it's gonna get harder. So, again, I just want to underscore for the last thing I will say, which is that I'm just me. A community member in Wellesley. I happen to be an infectious disease specialist. I happen to know many of you through Sustainable Wellesley. I don't know everything. And if anybody tells you they do, remember that they're going to be wrong about that. I don't know everything, but I'm willing to talk to you about what I see going on and what I know, and to express my gratitude and kind of solidarity with everybody. So I think I will stop there, and but happy to do it again sometime if it works out. So thank you, everybody.